Hey guys, it's Mrs. Malott. I am here with Chapter 7, Lecture 3. We only have two objectives today, if you can believe that. We need to describe and differentiate between the different types of medical asepsis, which would include sanitation, antisepsis, disinfection, and sterilization. The other objective is to be able to describe to me when hand washing is necessary. So we'll get started here today. So we've been talking about all these different things with infection control, and yesterday we finished up with talking about the steps in the chain of infection and things like that. We talked about how hand washing is the most effective way to prevent the spread of infection. So we're kind of picking up on ways that we can kind of control infections. And there's four major ways, and they are medical asepsis, surgical asepsis, barrier methods, and isolation precautions. So medical asepsis is the first way that we control infections. And anytime that we physically remove or kill pathogens to get rid of them, then we are performing medical asepsis. And there are four basic types. There's sanitization, antisepsis, disinfection, and sterilization. So when we sanitize something or we perform sanitization, we are basically just keeping things clean. We are physically removing pathogens, trying to prevent them from spreading. Could there still be some left behind? Sure. But just keeping things clean as possible, things like that. Hand washing is definitely a medical asepsis technique. Cleaning our eating utensils and washing them with soap and water. Wearing clean clothes. Putting clean linens on the bed. Like kind of just keeping things clean. That is what medical asepsis is. That's what that means. Specifically here with sanitization. And in antisepsis, we kind of take it another step and we not only kill the pathogens, but we try to prevent them from growing. So we use chemicals, but these chemicals are actually able to be used on the skin. So for instance, when we draw somebody's blood, we will clean the area, or we will use an antiseptic. Specifically, we use alcohol to clean the air, try to prevent any kind of bacterial growth or anything like that. Other ones that we use are iodine. Before surgery, they'll use other chemicals, sometimes Hibiclens, sometimes there's one called Chloroprep. These are all chemicals that can be used on the skin that keep the pathogens from growing. The next step in medical asepsis is disinfection. And again, these are chemicals, but these chemicals are not able to be used on the skin. These are chemicals that we would use to clean the desks, to clean instruments, things like that. You've heard of the term disinfectants. Think about the chemicals that we use. They're harsher. We don't like scrub or clean our skin with those kinds of things. So we would use disinfectants anywhere that we want to clean body fluids off of, whether it be bedside tables or a metal bedpan or something like that. The last form of medical asepsis is sterilization. This is definitely the most thorough way of killing microbes. When we sterilize something, that means we completely get rid of any type of microorganism that could be present. So anytime we put something in someone's body, we want to make sure that we are not introducing any type of pathogen in any sort of way. So anytime we use an IV catheter, or we use a urinary catheter and we put it in someone's bladder, give somebody an injection, do surgery. Anytime you're entering or putting an instrument or anything inside someone's body, whatever you do that with needs to be sterile. You need to be able to guarantee that there are no pathogens present, no microorganisms present. As far as the equipment goes, one of the ways that we do that is we have a special machine called an autoclave that heats the instruments above boiling and uses steam and pressure to sterilize and make sure that there are no microorganisms present. We can also do that by soaking in special kinds of chemicals, but I would say as far as equipment goes, the more common way is using an autoclave, and that is the kind of the most effective way. Because think about it, when we do surgery, we have instruments that we reuse, like, you know, whether it be a clamp. You don't want to use it one time and throw it away. They're expensive. You want to be able to reuse them, but you have to make sure that there's no chance of any infections or anything to be passed from one person to the next. Now, you may hear grandparents or somebody talk about, oh, you need to sterilize a baby's nipple, you need to boil them. And that is an old wives' tale. Boiling, does it remove pathogens? Yes. Does it remove every single one? We cannot guarantee that. So boiling is technically not sterilizing. So just keep that in mind. We were talking about there how sanitization would include hand washing. And hand washing is one of the most important things that we can do for our patients and make sure that our patients don't get infections and things like that. We touch so many things and we come in contact with so many things that hand washing needs to be done quite frequently. At minimum, your book talks about, on the next slide there, about some of the minimum things that would require hand washing. So when you first get to work, you need to wash your hands. Think about all those things you touch on the way up to your unit. You touch your car keys, you might touch a door, you touch the buttons in the elevator, you touch another door to get into your unit. You know, maybe you pick up a pen, you know, anything like that. So you need to, when you first get to work, you need to wash your hands. When you go into a room or a supply room, you need to wash your hands. Anytime you handle linens, you wash your hands. Before you handle somebody's food, you wash your hands. When you take a break or when you leave for the day, you wash your hands. Before you eat, before you drink, before you take a smoke break if you have that bad habit. Before you put contacts in, before you use the bathroom. After you use the bathroom, after you cough, after you sneeze, after you blow your nose, after you touch anything that could even potentially be contaminated or dirty, when you pick something off the floor, when you take off your gloves, anytime you touch your face, whether it's to put makeup on or lip gloss or anything like that, those are at minimum times that you're going to wash your hands. So you can see how in the healthcare setting, you're going to be washing your hands a lot. Every time you go into the patient's room, when you're done doing something with your patients, when you take your gloves off, when you leave the patient's room. So you could, in one time that you're entering a patient's room, end up washing your hands 2 or 3 times per patient, just when you do all those things. And so it can become something that is quite a habit. Nurses wash their hands a lot. So do nurse aides. So do really any healthcare worker. One thing that might save a little bit of time is what they call hand rub or alcohol-based hand rub or whatever you want to call it, hand sanitizer. It's a lot quicker, and you will find hand sanitizer placed on the walls in most patient rooms, in the hallways, places where you need access to it. For the most part, you can use hand sanitizer anytime that you want. The exception would be if you physically see something on your hands, you need to wash them with soap and water. I would add that anytime after you go to the bathroom, it's a good idea to wash with soap and water. Also, the only other exception would be when you're dealing with certain illnesses that might be transmitted through an endospore, for instance, Clostridium difficile. Those illnesses when you put hand sanitizer on, all you do is move those spores around on your hands. You don't really get rid of them. And so when you're taking care of somebody with an illness like that, you are required to wash your hands with soap and water. You can't use hand sanitizer at all. When you use the hand sanitizer, it's important to make sure you cover all parts of your hands and you allow it to dry before you go and touch the patient or you touch equipment or anything. It's important to let it air dry. You don't want to wave your hands around or anything like that. Just rub it on, let it dry, and then you can get started with doing what you need to do. All right, well, that is it for medical asepsis. If you have any questions, please shoot me an email, and otherwise we'll see you tomorrow.